Greetings everyone, my name is Esteria Cruz Vasquez, and today I'm going to be focusing on the increase of deaths amongst doctors in Mexico. So the reason why I wanted to focus on this specific issue is because currently, as of right now, Mexico is actually ranked as the #1 country with the highest healthcare worker deaths, and the second ranked country is actually the United States of America, with the third one being the UK. So that's just to give a little perspective about how big this issue is, and also other countries that are affected by this issue. But the reason why Mexico has been affected tremendously is because of the lack of personal protective equipment. Because of the lack of PPE, they have been struggling with not getting infected with this disease. And as of February of 2020, after their first case, that's when actually they had the shortage. Literally 3 weeks after their first case. And as Alvaro Martinez de Leon mentioned, he's actually a medicine specialist in Matamoros, Tamaulipas, and he was actually able to witness this. He did also mention that a lot of these doctors that got infected was not only just because they didn't have the proper PPE, but also a lot of these doctors did have predisposed diseases. Like there was a couple of them, well, the ones that he witnessed died because they did have high blood pressure and they did have diabetes. And they were obese. So these contributing factors did affect them, especially once they got COVID-19 because of the lack of PPE. So that is definitely an issue that needs to be addressed in Mexico. And also, they are not following CDC guidelines as they should. In Mexico, they are not reinforcing the CDC guidelines with the 6 feet apart and wearing a mask. And then on top of that, they are also not doing contact tracing. So it's a lot harder for an individual to know if they were around someone that was infected without that knowledge. So that is definitely a contributing factor. And they're also not doing as much testing as they should. So the numbers are not accurate. There is definitely more people infected with COVID-19, but because of the lack of testing, that is unknown. So for sure, that is those are the reasons that they need to keep advocating and keep focusing on to make sure they can get through this pandemic. And one way that they have tackled this issue was through a union that they created as health professionals. They created this union that advocated for them to get more PPE. And although they did get PPE, they're in a lot better place than they were in the beginning. That PPE that was received, it wasn't the best quality. So it's a work in progress. I hope that they are able to get through this pandemic together, and of course with the proper PPE and the proper help of the government.